All right, in this video, we're gonna go over hip extension with a slider. So keeping that foot in contact with the ground, keeping the calf involved here. So when you go from mid stance to terminal stance and you're pushing off that phase, getting the hamstrings, calves, glutes firing at the same time. So definitely gonna be cueing the glutes to fire once your leg is past midline and you're going into that trailing position. So I'm using a red TheraBand that's kind of moderate level. Just make sure wherever you fixate this that it is very firm and it's not going to snap on you. We got the slider here, so make sure you're using a surface where that can, slide pretty easily. You can use something for balance if you'd like, otherwise you can work on balance a little bit. But what you're going to do, toes are facing forward, slight push down into the big toe. As you are trailing back, make sure the knee is extending as you come back. And I want that glute to fire, especially in this trailed position. That'll share the load with the calf, with the hamstrings. And then I want you to slow and control, come back forward. So again, sliding back, keep the pressure on the big toe. Glute is firing, if you feel it in the hamstrings. So basically, as you're going through this, I want it to be nice, slow, and controlled. High reps, 15 to 20 reps per set. Again, keeping the big toe in contact. You should feel glutes activate. If not, you have to intentionally fire them for a bit just to remind them, all right, this is your job in this position. So give that a shot. You want to make sure your pain is definitely less than a 3, a 2 out of 10 pain, and that once you stop the exercise, that the pain does not linger. Progress over time depending on how you respond by increasing the resistance, increasing the reps, or reducing your rest period. There's a lot of ways you can kind of modify this, but let's go ahead and start there and give it a shot.